And it's listening, but being present. So to me, there was like hearing and then there's listening. You can hear everything that is happening around you. And you're hearing because you're trying to get the answer. You're already thinking of what you're going to respond. But when you're actually listening, when you're present, you're in the moment, your full attention, your full attention is on your son, your daughter, your mom, whoever. It's such a different experience. You're giving a little piece of you to that person. And that is what's going to, I'm hoping, change little by little the world that we're in right now that seems to be so angry.
Welcome to Hear Me Out with Belinda. Today I'm chatting with my friend and ex-colleague, Maria. Welcome, Maria.
Thank you for having me. I'm very excited to be here and share this experience with you today.
Well, thank you. Yeah. So I think we should start off by saying how our friendship grew, right? We started off as colleagues several years ago in a corporate hearing world. But I personally feel our friendship really grew after you'd had the same almost negative experience as I had before leaving. And then we could connect on that and really talk about that path.
Yeah, I think for us trying to heal with everything that has been going not just in the corporate world, but in our lives and the world really connected us. And we're on this beautiful journey together, which I am very happy to share with you.
Well, thank you. So I'll go back to my story. I worked for a corporate hearing clinic for just under 8 years. I was at the same location, and initially I really loved it. That they treated me well. I had good benefits. My kids were younger, so if I needed to call in sick, it was never a problem. I felt supported. And I think it was only as I got older and the kids got older where I started looking a little closer at things. And maybe things had changed as well, different management and different executive leadership. But when I started looking a little closer, there was these little signs that started happening. And I was like, they don't align with my integrity or my belief system of how to treat a person, especially a person in the hearing world where there's a trust factor, right? They're coming in, you're building a relationship with them. It's not a quick purchase and out they go. Like it's, as you know, it's a continued journey with them. Yeah, what did you feel? Did you have the same experience?
Similar, yes. I do resonate with what you say at the beginning. And I mean, it's like anything, right? When you're going, for me, it was a new industry, although I have been in the medical field for almost 10 years. It was a bit different, challenging, which I loved. I love to learn. So for me, I think learning about the industry and learning about the hearing and how everything aligns and it has purpose, I just really enjoyed that. But as you say, yes, unfortunately, there's corporations that maybe not see it like that. And it may not be the corporation itself. It may just be the people that they hire that may not have the background, may not know. It's very difficult for me to be the person in front, seeing all these patients or clients really suffer and struggle and not be able to help them the way that I would like to. Not that I was an audiologist myself, so I wouldn't be able to, but just to be there and listen to their story and be a part of it. It's so rewarding and yet frustrating at the same time, right? Do you feel like that as well?
Yeah, I think for me, it started when my youngest son, I was starting to explore the auditory processing and I'd had him tested. So I knew that he had an auditory processing weakness, which I knew was part of why he was disruptive in the classroom. And going into grade 3, he needed the help. And so I had approached management at the corporate to say, this is what the list price is it was the Roger system with the little Roger focus on his ears. And I was like, what sort of discounts can you give me? And at that time, they were list pricing at $7,000 for the set. And I was like, you people know what I earn because you pay me the salary. So I can't afford that. You know that there's no benefits, with our third-party insurance. So what can you do to help me, And they pretty much went all the way to the top and they turned around and said nothing. So I was on my own to buy it. So of course I did get the device for him, and the difference it made in the classroom and in his life was remarkable. And I'm really pro treatment of auditory processing, which is a different conversation itself, because it's not even diagnosed through Alberta Health Services. But that was just the start of the blinkers coming off for me. And I just thought, wow, they are not even prepared. They are in the hearing world. They have a partnership with the manufacturer of the product I'm going to be buying, and they're not even willing to help me. So that was part of, I think, the downfall as to the blinkers, coming off, and what led me into my own practice, my own clinic, where I have autonomy, where I can make the best decision for the client, for the person sitting in front of me. I'm not limited to this. I feel like it's become a cookie cutter, right? Like they teach you, like, this is what you're allowed to do. These are the parameters. You got to stay within this box. But people don't live in that box, right? So,
That's exactly it. And when I go back to being such a loving industry and also being so frustrating, right? It's that frustration as in you are the face, literally. You are the person in front of your patient. And to have your hands tied, not be able to really, truly give them what you as a person standing in front of them want to,
yeah.
it's frustrating. And there's not a lot of knowledge out there either, because it's frustrating in the industry, but it's also frustrating when it comes to their patients and they come and they see this advertisement and they're like, oh, I need that. Well, no, it's not what's best for you.
Yeah.
So how can you approach that when they're just, no, this is what I want. This is what the TV says. Well, no, let's try to educate all these people and let's try to do what's best for you. But I find that that is very difficult to do too when you only have a certain amount of time in the day to see so many patients and or clients, and where does that fit in?
Yeah. I think that's part of why I started this podcast, is for the education part as well, to educate the community on the importance, number one, of hearing healthcare, but also what is hearing healthcare? What does it mean? Like, you're not just buying a commodity. You're not walking in and buying something off the shelf. Like, you're relying on your hearing care professional to help you, right? There's a lot of auditory rehabilitation. There's a lot of counseling that goes into it to make sure that the person is successful with the hearing aids. And that's the part that I think where large corporations, going back, try to put you into that cookie cutter and sell this product, and this is what we're advertising, and this is what we're getting a good deal on, or a good profit margin on, or whatever the case may be. But it's not always right for that person. And then the consumers don't actually know that either, right? So they're seeing a good deal, they're seeing a good price point, and they're like, oh, that's going to work for me. That's what I want. But no, it's not necessarily what's the right fit for them. Like, it's not taking into account their lifestyle needs or their hearing loss or their listening understanding.
Yes.
Yeah.
Well, I would explain to our patients that would come in, and I was like, well, you have a hearing loss. Okay, so what's the next step? Well, you need hearing aids. Well, what if I only want one hearing aid? Well, that's not how it works. So I would explain to them, well, if you go get your eyes checked and they say you need glasses, do you only get glasses for one eye? And it's so different than glasses. You go, you get your glasses, you put them on, you can see a lot clearer. You take them off, blurry. Okay, you know you need glasses. But when people can hear, yet they don't realize, they don't understand, because nobody has taught them. It's not their fault. There's just no information out there. How by the end of the day, their brains are exhausted. They're tired. They can't remember. They can't sleep. Their cognitive starts to deteriorate because they have gone so long without aiding or helping that hearing loss. But then they come to a business where it's just like, okay, well, I unfortunately only have an hour with you today. Let's do this, 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 and this, and that. You don't have the time to share and explain, as you say, counsel, right? I believe, for me personally, because I did most of the counseling, was probably 80% of my day was counseling or helping them through this journey, because it's almost a partnership with your patient, right? They come to see you and they're struggling. What are you going to do to help them? And it's not just come in, here are your hearing aids, bye, we'll see you in 5 years when it's time to get new ones. You see them probably more than you see your family sometimes, because you're there more often. You
Yeah.
create a family with them. when you really care.
Yeah.
And that's where I feel that it's very difficult.
Yeah.
So as a friend, I am really happy that you have your own clinic because now you get to do those things yourself.
I know. And I think that's part of the story, right? I have many people. I mean, we can talk about the corporate and when I left and stuff and how they wouldn't tell anybody where I was. But, thank goodness for Google and YouTube and
Yes.
stuff, and people can eventually find you. And the amount of people that will travel down to come and see me, I take as such a huge compliment that had so much impact in their lives and that they trust me, right? And then some of them will actually say, I went to other locations or I went back, but it just wasn't the same, And I think that's going back to it. It isn't the same because the hearing care professional cannot be the same. They are limited in the amount of time they can spend with you. Their calendars are controlled. From the minute they walk through the door, from 9 to 5, their calendar is controlled by someone else. They have no say. They get told how much time they can spend with each client, how many tests they have to do a day, how many fittings did they do a day. Those are the metrics that they are then evaluated on for their own increases, right? For their own careers. So, of course, they're going to be focused on those metrics. I was the same. I can tell you almost the horror stories of colleagues and stuff that, focus on the selling part, right? And very successfully. And it would go back to, like the manager asking them, how many people did you help today? But when you tell them the story of the person who came in who was so grateful to you because you helped, clean and fix the hearing aids because they're from, out of town and they're here for, a family member's funeral service. And so by, fixing the hearing aids so that it can actually be present and hear that service was so impactful to them. But that's not what they're asking. When managements are asking you, like, how many people did you help? They don't want to hear that story. They want to hear about how many units you sold. And I think that's the most frustrating part to me. And it's one of the biggest things in the 4.5 years of being out on my own that I can say my partners have never asked me once, right? How many units did you sell today, Belinda? It's always been about the relationships. How many relationships have you built? Have you been listening? What's going on in the community? Are you active in the community? So that people, number one, start trusting. And I think that goes deeper and probably touching on what you're doing now is building those community that relationships and trust, because somehow, not this in hearing, but the last few years have been chaotic where we've lost trust in corporations and big box stores and this and that. And so we like starting grassroots again. We're starting to build those little communities, those networks of trust. And and that's where we have to be, is to build it up for everything.
Yeah, I would love to share a story with you that led me into what I am doing now, actually. As you said, building those relationships. I had, at the time, a patient that would come and see me. She would travel 45 minutes, and I wasn't even her professional that was literally helping her, but we just kind of, that one day I was there and I helped her. And what was supposed to be a 20-minute appointment ended up being an hour. And I was like sweating because I was like, oh my God, I'm going to get in trouble because I'm spending all this time with this person. To later find out that that person decided to only come to that clinic because of me was such an honor. It was such a beautiful experience. And I recall her saying to me, if you were my counselor or my psychologist, I would pay you right now. I get so much more out of my visits with you. And I'm like, I'm just here for your hearing. Like I'm not even, but I would listen to her. I
Mm-hmm.
would try and just be there for her, right? And I was hearing related. Don't get me wrong. I wasn't just wasting time either. But it was for her, her hearing was such an anxiety part of her life. And if anything just went wrong, she was like out. She couldn't
Mm-hmm.
function, right? So for me to be able to have that time, thankfully that day, that led her to be just such a beautiful soul that would look into coming to see us just because that day I gave her the time
Yeah.
and listened to her was what really got me thinking, what am I doing here?
Yeah.
I need to pursue something that I can continue to do this and grow for myself. And yeah, I left and then I went in to do my master's in psychology. So yeah, I am so happy with that.
So you're going to get to talk to people a whole lot more soon and help them and help guide them. And I think you're getting close, right? You're finishing next year.
I finished, so I'll be done December, my first year, and then I have half a year and then my practicum.
Nice. Yeah.
Yes.
Yeah, so all the counseling, all of the work that you did within the hearing led you to something, right? So I
Led me
think
to something.
that's always the silver lining, right? Or the positives of everything. I think you touched on something that our podcast producer said was we're better hearing starts with listening. And that's really with everything, right? If you're not listening to your client, if you're not listening to, your employee or your spouse or your child or whatever, there's a breakdown in the relationship, right? And and it's unfortunate that I think that that's where it all starts, right? Is we're not listening.
Well, and it's listening, but being present. So to me, there was like hearing and then there's listening. You can hear everything that is happening around you, and you're hearing because you're trying to get the answer. You're already thinking of what you're going to respond. But when you're actually listening, when you're present, you're in the moment, your full attention is on your son, your daughter, your mom, whoever. It's such a different experience. You're giving a little piece of you to that person. And that is what's going to, I'm hoping, change little by little the world that we're in right now that seems to be so angry.
Yeah. I was asked to do a presentation for a local company for their professional development day. And it was basically about hearing, because I do work with some, clients that do need hearing aids. And I thought long about it, and I went back and forth with what to put on the presentation. So I focused on hearing, and obviously hearing healthcare, but also the power of listening. And so how it combines together. And I did not a lot of research. I did quite a bit of research into the power of listening, and tying it back to one of my clients as well, of being present and his memory. And so although I'm not a scientist in that field, but it was very interesting to learn how if you're not present, you're not focused on that person, you won't remember it, right? So that's why we can sometimes drive home from work and we're so distracted, we can actually get home and think, how did I get here? Right. I think we've all had those moments, right? Where you can't remember the drive. And it's because you weren't present. Your mind was wandering all over. You were just going through the motions. And and that's where listening starts. And then, of course, you add hearing to that, where a person has a hearing loss and they're trying to focus, but there's external noises or they can't catch the words clearly. So they're trying to put the puzzle pieces together of the words that the person is saying. And it's a lot more complex, right? It's a lot more tiring. Like I said, that's where the whole people with a hearing loss can report higher rates of, anxiety and depression, because it's harder for them to be that active listener in those situations.
Well, and then they isolate, right? And if they start to isolate, they start retracting. They don't want to be with family or friends because, well, it could be embarrassing or it could just be exhausting for them, which then leads them to more anxiety and depression and then cognitive. And again, part of being in the hearing industry and now into psychology, it's fascinating how I'm learning how it all interlocks and being present and communicating and talking and listening. It's just fascinating to me. And I'm grateful that I got to witness and be a part of that experience to make it a little bit easier for me.
Yeah.
Right? How do you find it when patients come and they tell you that they don't know that they have a hearing loss, but yet they don't go out because it's too hard for them to hear? How does that make you feel?
It depends actually on the person. I think that's what I'm starting to ask myself now, why is the person coming in for a hearing test, right? Are they coming in or a comprehensive hearing evaluation? Because I'm trying to differentiate between that in that clinic. Now, some people just want to know that they're hearing within normal parameters. So, you can do a quick air conduction threshold test, make sure that that's within normal parameters, but that really doesn't tell you very much about the person's overall hearing, because going back to auditory processing, they test within normal parameters, right? They can't hear within noise. But so in the clinic, once again, I'm trying to differentiate between those that want just a quick test, they just want to know, to those that want that comprehensive hearing evaluation that really want to understand the hearing loss, and they are prepared to treat it should there be a negative outcome, meaning should there be a diagnosis that they have a treatable hearing loss, they are willing to pursue treatment with it. Because it's very frustrating when somebody's coming in. I actually had it last week. Because as a person, I value myself and I value my education and I value what I give my clients. But this person drove in from Vulcan. So it wasn't even a quick round the corner drive. And I think there was two things wrong with the appointment. He was over 75 and he came in, and one of the questions I'll generally ask is, what brings you in to see me today? So I can really just narrow down on what does this person need from me today? Like, how can I help them? And he said, oh, I came because I thought I'd help you earn some money. So I was like, oh, okay. I was like, so you have a hearing loss and you want to purchase some hearing aids and help, you want me to help you with it? He's like, no, I came for a hearing test. And I was like, so how does that help me earn some money? He's like, well, because you get paid for it. I was like, no, I don't, right? Like, you do understand, only the people working for Alberta Health Services in their diagnostic centers get paid to do hearing tests. All of the other private clinics, or when, your corporations, we don't get paid to do a hearing test. And so I'm not understanding. I was like, I'm happy to help you, and I will do your complete hearing evaluation today, but I do need you to understand that, so that you can, start spreading the word, right, to evaluate. So I did his hearing test. And at the end, he said, and he does have a significant hearing loss. And he was like, yeah, I know that. But it's like, I don't actually want hearing aids. I don't want to treat it. I don't want to do anything. I just came for the test. So it's almost like he was lonely. That's what I felt from him. He came in, he wanted the appointment because he wanted to connect with someone. And I said to him, you know what? This will help you reconnect with people by treating your hearing loss. You'll be able to hear better in this situation. So whether you're going into the grocery store and you're just making that idle chit chat with, the customer service person, you're making a connection with them. I said, I'd check in with him today to see if he's going to, but I left him with a little bit of food for thought, I'm hoping. But yeah, on that, like valuing things from that, what are we doing here? How are we helping that person? Right.
But again, we go back to there is a lack of information out there, right? It's because, again, you go to get your eyes tested, and if you're under a certain age, it does get covered by Alberta Health Services when hearing doesn't. But then there's certain companies that will charge for a test, and not all of them do. So then they're like, because I would get so many calls, well, how much is it for the test? Well, it's free. Oh, well, then why haven't I ever known about this? I'm like, I don't know, come and get tested. I'm like, it's free. Or I don't need to be tested because I'm young. I'm not old. Well, no, there's like hearing loss everywhere. There's so many reasons why people have a hearing loss, right? Medication, viruses, like you just got it inherited from a lovely family member. There's just so many things out there that are not known.
Not known, yeah. And going back to the education part, I think I've mentioned on one of the other podcasts the stats in Canada. And they actually say 60% of Canadians between the ages of 19 and 79 have a hearing health care problem, concern. And that can be tinnitus, and it can be hearing loss, and it can be a combination. But 60% of adults in Canada need treatment for hearing care. And they're not getting it, right? Because they don't even know. They're not even aware to go look for treatment.
And then on top of that, you get the people that do know that they have a hearing loss, and they see a commercial and they're like, well, I want that hearing aid. But that hearing aid may not necessarily work for them because there's so many different ranges and things that you could help with, right?
Yeah.
Or tinnitus, they may not even need hearing aids, but they need to do more cognitive therapy, or there's so many things.
Yeah.
But again, until they know about it, but in order to be informed, you need that time to be able to explain.
And circling right back to the beginning, right? When you're in that corporate environment, you don't always have the time. I remember they used to book us an hour for a new patient or new client coming in for a new hearing test. So you're just meeting them. You're just starting to ask the questions about their auditory health. And then you got to do their test. And then if they do have a hearing loss, you need to sell them their hearing aid, right? And when I moved, that was the first thing I did is I changed all those appointments to an hour and a half because then I have time. I'm not rushed. I can sit with them. I can chat. It's a more relaxed atmosphere. I feel better. I'm actually getting to know the reason why they're there. Because really what it boils down to is what are the reasons that person is seeking help, right? And how can I help them? Because that helps me help them, whether it's the correct product, or it's a tinnitus masker, or it's, sending them, for counseling, right? Whether it's mostly just a bit of anxiety and depression, where they don't actually have a hearing loss at all. And going back to creating those networks within the community, collaborating with your family doctors, so that we can create this network to give good client care, to everybody. I just worked with a client very recently where, and it's a bit hard for me to say because he actually ended up passing, which was devastating to me. But he came in early February. He wanted a hearing test. He knew he had a hearing loss. He had been to a large corporate prior. He couldn't afford the hearing aids. I said to him, let's start at the beginning. Let's start looking. He described how he was over 70, but he had been a trucker his whole life. And he had ended up in hospital last year for about 4 months. So his income had declined significantly. But of course, we know that, tax season and they don't, Alberta Health doesn't always, Alberta Aids to Daily Living doesn't always list you as a low income senior immediately. You've got to go through these paperwork things. So I said to him, okay, well, let's, have you taken these steps? And in truth, I didn't actually know all the steps. I know the very basic steps of getting a low-income senior a hearing aid, but I don't know how a person becomes a low-income senior. Mm-hmm. And so in February, we started the paperwork, and I reached out to the local tax consultants for seniors in Okotoks, and apparently he'd done all the paperwork. But it was recommended then that he'd come back because in July, because then he would be listed as a low-income senior based on his 2024 income. So he came back, and actually he was, over the 3-month period, he would be $30 over per month to make that criteria. And so then we start working again. And at this point, I'd actually ordered in some demo hearing aids for him, and I was fitting him with them because I just, my heart ached for him. I looked at him as if I'd see my father, and I thought, somebody needs to help my dad. I can help this man. Anyways, I spent a lot of time with him. Eventually, I ended up calling, AADL with him, and obviously he didn't press, and they would always check that he gives me authorization to hear the conversation. And we eventually got him to do the correct paperwork to be listed, because there's those different income brackets from low income to certain medical things are covered. And just as we got it all finalized, just as everything was changing for him, I actually read his obituary that he had passed, and his partner came in and actually gave me back, the demo hearing aids a couple of weeks later, and was so grateful, and how life-changing it was for him just wearing those hearing aids those last couple of months, right? And in fact, myself and my receptionist, Holleen, we took a day. We were working that day, but it hit us quite hard.
Yeah.
And those are the things that people don't realize, that it is such a personal relationship with your hearing care professional. It's not a quick fix. It's walking in, it's taking the journey. And when you have time, and that's the whole point, when you become a hearing care professional, you actually want to help people. You're not there to be a salesperson. And I know we're all selling things. We can, go into that. Everybody's selling a service of some sort, right? But you go in because you genuinely want to help and make a difference in a person's life. And if you're not allowed the time and you got to fit into this cookie cutter box, it can get frustrating for those that really want to take the time to help. Yeah.
It is very frustrating because you are the face, you are the person, you do create a bond. And in order for them to trust you, it goes both ways, right?
Yeah.
So you want to be there to provide and be there to support, but it takes time. But once you've created that bond, that, I don't want to say friendship, but it's almost like a friendship, because if you have a patient that is willing to follow you and drive 45 minutes to see you, or they find out that you've left a clinic because they can get a product anywhere.
Yeah.
It's the service that they're looking for. And if you're not providing that service,
they can go anywhere,
they can
right?
go anywhere.
Because it's not the product. And I think that's where a lot of going back to corporate here in world and other corporates, right? And, even maybe you'll face it within your new role, right? Because hopefully they'll do a little bit better because they'll know.
Open your own business.
um, but yeah, I think that is going back to the whole community feel and helping each other and, building. I do feel like we're building from the grassroots up again within, communities. And I think being in Okotoks is really great because we are a smaller town.
Yes.
I don't think it's impossible to do within the larger cities because you find your suburb and you can build within your suburb and stuff and network within your suburb. So you're still getting that smaller, community feel of everything. So I think it can be done anywhere. It's just maybe a little bit harder, but you have to just find those connections. I think of the Rotary Club, being a member of the Rotary Club of Okotoks. There's Rotary Clubs all over. And so just connecting in those different areas, you're starting to create, they're trying to do good within their local suburb or their local, community. And there's several within Calgary as well, so just we're going off in all angles here. But I think the message is the same, right? It's like supporting local, going grassroots up for everything. Right?
Well, I remember as a kid when you're told, treat people the way you want to be treated. And it is true. You do it everywhere, anywhere. You go grocery shopping, the person that's helping you bag, right? If you're loving and caring to them, you never know where they're going to be down the road 5-6 years. They may end up being your boss.
Yeah.
But if you are truly doing it from your heart, it's only going to pay back.
Exactly.
And then it goes over to the next person and the next person. And then we create this beautiful community and we help each other out. It's not about who's better or who has the best product. You know what? It's not like that. Again, it's the service and love that you give out, that energy that goes out, and it just makes such a difference.
Yeah.
Right? If you can be positive and you can see, there's always going to be bad experiences. There's going to be good experience. But what did you learn from that experience is what's going to make you at the end a better person.
Yeah.
And by being a better person, you're going to grow and you're going to be able to help other people and support them and be there for them.
Yeah. Actually, yesterday I was really flustered. I had bought some Christmas pajamas. It's a big deal for us because we don't have a lot of family here. So we have actually planned a trip with what we call our family, and so we're meeting in Banff for 4 nights, and there's 3 of them and 4 of us. So, 7 pajamas. So to find matching pajamas, it's quite it's not easy. So anyway, I was on Walmart's website and I even got Ethan because there's no schools right now. Teachers are striking. So he came in with me last week and we picked out everything. And just as we find the right, pajamas that everyone's going to be comfortable wearing, we think, then they're out of stock on the sizes, right? So you have to go. So it was this whole thing to find the correct pajamas. Finally, we got it, paid for it, put in the delivery. And Sunday was the delivery day. And at about 12 o'clock, I got a notification saying that my product had been delivered. And of course, they give you evidence now, photo evidence of the product being delivered. And it's got a beautiful green border, this house. And I'm like, that's not my house, like whatever. And I was upset, right? So I was like, okay, so let's deal with it. I have a busy day on Monday. So I called. Number one, to find a number to call is hard. Then you have this automated service, and eventually, they will transfer you to a real live person to talk to, because of course there's nothing on there that states your product's been delivered to the wrong address, right? There's nothing like that you can click on or type in. So eventually I get through to a real live agent, and they very quickly shut me down and say, there's nothing they can do today. It's just been delivered. Maybe the person will correct it. Call tomorrow. I was like, no, I don't want to call tomorrow. I'm calling customer service today. What is the point of having this photo evidence if you're not going to react to it, But I couldn't get, even though I was getting upset, I couldn't get upset with that person. He's reading his script. He's in this little box. It's like we used to be. And all he can do is operate within this little box. Eventually I said to him, look, you and I are not going to, anyway, can you maybe call your supervisor for me? Maybe your supervisor can help me a little bit better. So anyway, he did call his supervisor, but now we're going on 30, 35
Yeah.
minutes of my time on a phone call. Never mind never mind the amount of time I spent actually
Ring and
ordering and everything. The supervisor comes on and he says to me, you can't do, I was like, he said, you can't do anything until tomorrow. What if they credit? I was like, and what if they don't? I was like, how have you actually helped me today? I'm calling customer service. I am the customer. I did my part. I've paid my money, right? I've put in the correct address. You, as the representative, have not done your part and you haven't done anything to help me today. So eventually, eventually agrees he's going to call me today at 9 o'clock. And should the delivery have not been corrected yesterday, I'm going to get a full refund. Well, of course, that call did not happen at all. I mean, so now I have to go and spend another half an hour of my day trying to get through to them. And really, I shouldn't. And going back to if there was a local company that I could have ordered my pajamas from, I would have paid a little bit more. And I would have had them by now, because then I could have been dealing with the real person. I could have gone to their store or their house or whatever and say, let's fix this, whatever. But going back to it's frustrating. People don't want that frustrated. We have too much else in our lives going on. And it frustrates me more because I don't give that level of service.
No.
I am there. I'll go to a person's house to fix if, something, right? We'll go set up the TV connectors if they need, if they can't figure out, we will go and set up the TV connectors to give them that listening experience that we know is going to be impactful to them. So when we're not getting that service back, even though I understand that they're just in their little box and they can't get out of the box, I'm like, I want more people. I want more people to open up and be this, community of things.
Yeah.
So,
Well, and again, being in a community or community-based, I remember through COVID and right after COVID, when, again, we have all these patients that can't hear, right? There's some that really can't hear. And it could be something as simple as just a wax guard that they haven't changed, but either they can't see properly or they have problems with their fingers. They just couldn't, and they couldn't come and see us. So how many times would we talk about, oh, I'm off to High River to help a patient? And again, we were not allowed to do it. So we're doing it on our own time. And I would put the stuff at their door and I would knock on their window. And from outside, I'd be like, okay, we're going to do this. And walking step by step. I can count, probably if I put the hours together, months that I would do it. But those patients would come back.
Exactly. Because we went the extra mile. We went to go and help them. We knew that they needed help. Our large corporate wouldn't allow us to help them, not within the parameters. And so we were doing it in our own time, right? It was.
How is it their fault that if we close a location and then we relocated and they purchased and they made a commitment to us to come and see us, and now we pull out and then all of a sudden they're just left hanging? So it's like, no, I would drive in and I would bring them batteries and I would whatever they needed. And again, I did it maybe for me, but I was the one that was there and sold it to them. So I can't go back and say, sorry, done, right? It's just that little element, that little tiny piece.
I think that little part of you were the one, right? You were the one. And so I know when going back to the large corporations again, there's no more loyalty, right? I remember my uncles, they are going to be turning 90 and 88 next year, I think. Yeah, that's correct. And they would always talk about be loyal, right? Because they stayed at their companies for 40 odd years, right? So by the time, I remember when the one retired, he had 2.5 years of vacation built up. Never before right? We don't hear about these things anymore. But there's no loyalty to the person. I remember when I left, and I left because they didn't value me and there was no loyalty to me as a person. I went, above and beyond. But because I didn't fit in their box anymore, there was a slow breakdown, I think, in the relationship because I challenged their integrity on a few things. And I thought maybe I'd go into that today, but I'm thinking I'm going to leave that today. But I definitely challenged their integrity on a few decisions they made. And so I knew that the right thing for me to do was leave. And I think you had a similar experience.
Well, loyalty, what does loyalty even mean anymore? And of course, it's going to be different for every person until you ask that person what loyalty means to them to get a better understanding. But there is no loyalty. When you are working and you're giving your 130%, you are going above and beyond, and not as a requirement, just because that is the people we are.
Hmm.
Because for me, if you're getting into this industry, any medical professional, I shouldn't say any, but the majority of them at
Yeah.
least, they do it because they care, they love, they want to help. My daughter, she's going in, or she is in university now, as so is your son, right? Same university, funny enough.
Yeah.
And she wants to be an optometrist,
Yeah.
right? And at one point, she even thought, Mom, maybe I'll become an audiologist. And I was like, well, we'll sit down and we'll talk about it a little bit more, because yes, it's not as easy as it would be for optometry, because yeah, you sell, they're gone. But again, going back to that loyalty where you give and you give, and then you're not allowed to talk about salary, you're not allowed to talk about this, but everybody does. Come on, like, let's
Yeah.
be honest. And then you find out that a new person just came who does absolutely nothing, is rude to the people, and they're being paid more than you,
Hmm.
or or they've been promoted and they're doing. So I guess it goes back to who they're hiring.
Hmm.
They may not be hiring the right people for the roles, and then the good people, the people that are actually caring for the patients, are the ones that end up leaving.
Yeah.
And maybe that is a good shift for us, right? Because
Yeah.
then we evolve, we become who we really want to be. And that is going to go a lot further than being in a big corporation where your hands are tied and you really can't do anything.
Yeah.
And it's frustrating for you, it's frustrating for the client or the patient. And the
Yeah.
people that are hiring all these other people that don't quite know perhaps what they're doing, or are not in the industry, because you can hire somebody that's been in retail for 20 years. That's awesome. Well, do you want to be seen medicalized, or do you want to be seen as a salesperson?
Person. Yeah.
Do you want to sell cars, or do you want to help people with their hearing? We're
Yeah.
calling it health, hearing health, but then your corporation is not really holding to
Align.
those values. They're not aligning. So then, like,
Where is
that's
the?
gonna, it's a
Yeah.
fine line.
Yeah.
But if you do it right, you
You
can,
can.
right?
Yeah. I was just actually thinking about a YouTube I watched yesterday on AI, and specifically, as you said, both our kids are in university, both wanting to get into the medical
Yeah.
field. And I was looking at the AI, and they were talking about medical fields or doctors that AI will replace. And it's really actually the only one that popped up was radiologists. So there is still a need for radiologists today. There's a shortage of them, but that is the one specialty that AI could replace in the medical profession, because it's data in and data out, right? They can those computers can be taught to read the data and then give, but everything else, the key point is that human connection,
Mhm.
right? And I think that's, people forget that, like, people want a human connection. People need a human connection. Going to my frustration yesterday, the automated service wasn't doing it for me. Like, I tried to use all the automated things. I tried to do everything online, but in the end, I need a person to help me. And so that's where those hearing care professionals come in. That's what we need to do. We need to spend time with people. We need to help them. We need to connect with them. We need to build relationships. We need to help them on their better hearing journey.
That is true. And it seems like more and more people that we know that are in the industry are pulling out, or they're burnt out, or they are going and doing their own thing.
Yeah.
Like, I remember one of our colleagues, and I think you got to know her or met her, but she has been in it for so long and working for the big corporations. And I remember telling her, I'm like, hey, there's this position available. If you, she's like, no, I will never go back into the hearing industry. I'm like, it broke my heart. She's doing something completely different, but she was just so defeated, I
Yeah.
guess is the word, right? Because she had so many patients that would follow her and loyal to her.
Yeah.
So that when she left, she's like, it broke my heart not to be able to give them a place to go see me. And all I could do was refer her or him or her, whoever, to people that I knew and I trusted.
Yeah.
But again, it goes back to a person she trusted,
Yeah.
not a corporation, not a name brand, not anything. And yeah, she's doing great, but it is eye opening. It
Yeah.
really is.
I think we should probably call time today because you and I
Yeah,
can
probably.
chat about this for forever.
Yeah.
But it was a really great. Thank you so much for being on the show. And I'll just go back to all of our viewers. Look local, look for the connections, I guess, and look for the right person to help you, whether it's on your better hearing journey or just connecting in the local community.